Welcome to day 2 of the ASH annual meeting, where thousands of oral and poster abstracts are being presented here in Atlanta as well as on the virtual platform.
This year's topics include advances in immunotherapy, new insights into blood disorders, and approaches to acute leukemia care across age and race. Let's give a listen now to some of the science being presented at this year's annual meeting. One notable abstract reveals disparities in access to care for certain patient groups and raises questions about how to make clinical trials more inclusive.
Acute lymphoblastic leukemia happens to have an increased incidence among Hispanic patients in the United States. And so as we're thinking about our trials, I think it's very important to open studies in ALL where there are large proportions of Hispanic patients.
Encouraging results from CAR T-cell therapy trials could lead to significant advances in patient outcomes. Breakthrough treatments in the spotlight include isatuximab, liso-cel, and axi-cel.
The use of CAR T-cell therapy compared with going down the standard transplant approach really looks to be far superior. And clinically, with fairly mature data in the axi-cel trial, it looks like we're curing more patients by going down that route.
The challenge now is for clinicians to identify patients who might be appropriate for CAR T-cell therapy rather than the standard approach. 3 researchers also presented new insights into blood disorders at a Saturday morning press briefing. Dr. IRENE GHOBRIAL has been researching multiple myeloma in high-risk patients. 2 such groups are people of African descent and those who have a first-degree relative with the disease.
So we know that African Americans have 2 to 3 times higher chance of developing myeloma. And this has been well known, yet not well studied. We don't know why. We don't know what is the risk. We don't understand what puts them at risk and how can we prevent that. And if we can detect it early, can we truly make a difference in their survival?
Dr. SIDDHARTA JAISWAL and his team at Stanford University have been studying CHIP and blood disorders in the aging population. His team found evidence that having CHIP may help reduce the risk of Alzheimer's disease and may lead to future treatments.
That was very surprising. As I mentioned, CHIP has been primarily associated with adverse outcomes. So it was surprising to see in this case it's protective. But I think it just speaks to how complicated biology can be. Things are not always all good or all bad. In this case, there seems to be a positive benefit of possibly replacing these malfunctioning cells in the brain with cells that are primed and ready to do the job to help prevent Alzheimer's.